welcome to the Art of Being Human. You know, we're almost finished with the section I've been doing on PTSD, and we'll probably finish it either today or next segment. But I want to mention a couple of other things first before I finish with it, and that's the problem with attachments and what difficulties babies have in learning how to attach, and also self-talk. I think I'll go into self-talk first because it can be used as a therapeutic tool. You can use it as a therapeutic tool yourself, so I think it's easiest to describe. In self-talk, you talk to yourself, not necessarily loudly so anyone can hear you, but in your mind, you talk to yourself as if somebody else was talking to you. Like, for example, supposing that you're playing on a basketball team and you're a little nervous, you don't think you'll do that well, and maybe it's getting close to playoff season, you want to do as well as you can, but you're a little dubious as to how well you can do. And then you have this inner voice, and you start talking to yourself. You can do it. You're talking like the coach. It's like you're pretending to be a coach, pretending to say the things that your coach would say to you. You can do it, get in there, play your hardest, you'll be all right, etc., etc., etc. And that helps to take the edge off. Now, I've said before, and I really mean it, that if you acknowledge how you're feeling, you have to acknowledge how you're feeling, and that takes the edge off from the pain of it. If you don't, the feelings become more and more and more intense. And the reason that they do, it's like you have these feelings within you that are asking to be acknowledged, and they will fight to be acknowledged. And if you don't acknowledge them, they will become more and more intense until finally they do become acknowledged, and then that kind of takes the edge off from them, and they're not quite as intense. But that's not enough. You have to go further than that. You have to acknowledge how you're feeling and then go further. For example, supposing you are in the sports team and you're playing basketball and you're really afraid and you think you're not going to do very well, you can admit to yourself, as if you're just kind of giving yourself a pep talk. Yes, I am very nervous. Yes, this bothers me. I don't know how well I'll do. I'm kind of nervous that I won't do well, but I'm not going to stay in this spot. I'm going to get better and better. I'm feeling better already. By the time I hit the courts, I'm going to be just fine. So you do two things. You acknowledge where you come from, where your problems are, and then you move on to the next step of improvement and feeling better. So if you're self-talking and you're using it as a therapeutic tool, and I have taught some people to do that, I'm nervous, but I'm not going to stay that way. I'm afraid, but I'm not going to stay that way. I'm depressed, but I'll be better by noon because I always get better by noon. So you are actually acknowledging your feelings and taking the intensity off from acknowledgement and then moving on to the next step. I used to have some clients that I was working with that used to do it. I hadn't trained them to do it, but they used to try to do it. When they were in a fix, they didn't feel good, they were having a bad day, they would pretend that I was with them, and they would tell themselves what they think I would say had I been there with them. So they were kind of self-talking and using it, trying to use it as a therapeutic tool, and talking as if I was kind of their life coach and I was telling them how to feel, and they were responding to that. The problem is it's not always foolproof, because sometimes they would come in and they said, you know, I said this to myself, I said that to myself, and that wasn't what I would have done at all. So it's not altogether foolproof, but it does help. And if you realize that if children can acknowledge, I'm angry, I don't feel good, then they can get an edge on the fact of how they feel, and that lessens the intensity for them, and then they can be taught to feel a little different. I was in an office once. I was doing a consultation with a psychiatrist, and there were two children practicing, and one child was bothering the other child. And it was interesting to see the interchange between them. They were both pretty young. I'm not even sure they were school age. If they were, they would have been maybe in the first or second grade. And one child was acting in a belligerent way, and he'd throw down some little toys or something, or he would interfere with what the other child was doing. And the other child was kind of like playing a psychologist. I don't know if he was doing it because he'd heard someone talk to him like that, or whether he was just doing it on his own. Well, how would you feel if I did that to you, he said. How would you feel if I destroyed your play? You should know better than to do that to me, because if I did that to you, then that would not be right. And the other child didn't even respond to it. He just kept on doing what he was doing. Now, they were both pretty young, but one of them was using some kind of, or trying to use some kind of a psychological technique so that he wouldn't be bothered by this other child. Had because I was an adult, but I wasn't the child's parents, and I didn't know as I had the right to do it, but at that point, I would have stepped in. If it had been my children, I would have stepped in. And I would have taken the one that was the one who was causing the problem, and I would have sat him down and I would have said, there are some things you can't do. Whether he understood the psychodynamics or not, he was young enough, so maybe he didn't. So maybe he didn't understand a child saying to him, what would it be like if I did that to you? Maybe he couldn't reverse it. Maybe his brain wasn't developed enough to understand that. But I would have taken him off to one side and said, these are the things you cannot do. For children, things have to be structured. You can't do this, you can do that. Well, getting back to the self-talk, a child or an adult can learn to do some self-talk, but you have to remember that it's not always a reliable technique, but it does help to take the edge off. So that's one thing I wanted to discuss with you today. The other thing I wanted to discuss before I finish with the PTSD is attachments. We all attach to other people as we're growing up. A baby who is born does not know the difference between himself and anybody else. A baby is like a tabula rasa, and what that means is a psychological term, and it means a vacant slate. It's like you have a slate and there's no markings on it. It's like a chalkboard, a blackboard. There's no markings on it. Tabula rasa, nothing there. And then gradually, over a period of time, they learn to differentiate between themselves and another person. And usually that happens, it starts to happen fairly early, and then they start to try to acknowledge another person. Now, they're not sophisticated. The brain is not sophisticated at all. It's growing and it's developing, and they don't have a good, clear concept as to who is them and who is not them. For example, if a child is watching a show, let's say a show on dogs, let's say it's Lassie, for example, they will feel that Lassie is in the television set. When they look at the TV and they see the dog is in the TV set. Well, why not reach in the TV set and pull them out? So you have to watch children who are watching television, because they don't get a good, clear image of what's them and what's on the TV, and as a result they can get into trouble for it. And it's not like they're misbehaving, they just don't have the sophistication in the brain to understand that there is a good, clear difference and the dog is not in the TV. Well, I mentioned that, but as the child grows, he starts to differentiate a little bit. He starts to realize when he's crying, somebody comes. When he's hungry, somebody comes. And so he starts to understand that as he starts doing certain things, that somebody reacts to him. Usually it's the mother. It's usually the same person each time, although not always the same person each time. And so they will start to smile. I can remember my nephew, my first nephew, the oldest one. He was born and their family was living with our family at the time. And we noticed, I don't know why I remembered this, but he started smiling at 19 days old. And I put that somehow in my brain, and I always remembered it. At 19 days old, he was able to smile when somebody came to pick him up or to feed him or to bathe him or whatever it was. He knew that they were there for his benefit, and he would start smiling away. Now, a lot of babies, they start smiling if they have gas, but that's not a true smile. That's a biological reaction to gas that they have in their stomachs, you know, when they're eating and so forth, when they're sucking on a bottle. But at 19 days old, he was starting to smile at people coming in. He was starting to recognize, here's a person that's not me, and here's a person who's coming in to take care of me. Now, we find that a lot of people have difficulty in attachments if they have mental disorders. I'm thinking particularly of autism, but that's not the only one. Some major psychological difficulties, some major mental illnesses, people do not attach themselves to other people, and they're called attachment disorders. They stay in their own little world. I mention autism because sometimes in autism it's so obvious, but autism is a spectrum disorder. And I know the DSM, they are revising the DSM. I've talked to you about the DSM-4. The DSM-5 will be out at some point, and they're going to redo autism. Autism is a spectrum. And what it means is that you can have a little of it, or you can have a lot of it. There are different degrees of it. A person who has a very bad case of autism, if I can use that word, bad case, they don't talk. They can't respond. They're in their own world. You can't make contact with them. They don't make contact with you. A person who has a higher or less amount of it, like for example Asperger's syndrome, which is a part of the spectrum disorder of autism, they're able to get jobs, go to school, they can function. Now, they may have problems in human relationships. They may not understand things. They may get stuck on things that they worry about that other people don't worry about. But they can live in society, they can go to school, they can get a job. It doesn't mean they're not autistic, because at some point you'll know there's quite a difference in the way they respond to things than what other people, how other people respond to things. But certain major illnesses don't have, people do not have contact with other people. They don't make contact. I've seen some of the autism people that I've seen that have it. They can go into an office and they sit there and they can't talk and they just make noises. And in one case, I was sitting in an office. It was one of my own doctors, and they brought in a child that was autistic, and they had him kind of in a brace, and they also had a kind of like a leash attached so he wouldn't get away from them. And he was just all over the place, yelling, making noises and all of that, but he couldn't communicate. He really couldn't, and it was an embarrassment for his mother who brought him in, but she's not at fault. If you have an autistic child, don't blame yourself. It's not your fault. X-rays of autistic children show that their brains are not the same. They don't develop the same as a normal child. Now, a baby should be able to respond like my nephew did at 19 days old. Within a few weeks, they should be able to smile at you, look at you, make some kind of contact with you. Of course, they're much too young to talk, they're much too young to do a lot, but they can let you know that they recognize you, they know who you are, they're smiling at you, they're making noises, they're grinning sometimes, they're moving their arms, and when they get older, they reach out for you to pick them up. So there's obvious contact there. But you see, with a person who is not making contact, they don't have an attachment with you. If a baby is 6 months old, you pick him up and he pays no attention to you, he does not respond to you in any way at all, then there's a definite problem. And the problem may be autism, where he cannot make contact with you. And I believe the answer is in the physiology of the brain. The brains aren't the same. So it isn't anything, if you have a child like this, that you would feel guilty about. It's not your fault. You can be as loving a mother as you can be, but if the baby has autism and can't make contact, that's a physiological problem within the child's brain, and it has nothing to do with the quality of care that the mother is giving it. But there are certain signs that you need to notice early on, because children who are autistic can receive training. They can receive training and education and therapy to help them break through their wall of silence so they can start making contact. One interesting case that I was aware of is that there was one child, I saw a movie on it, and I think it's significant enough that I should talk about it. The child was autistic, diagnosed as autistic, and it turned out that somehow doctors discovered that she wasn't hearing properly. She wasn't deaf. She was hearing everything too loud, much too loud. Like we could drop a pin and it would make a little noise, but it's hardly anything that you would bother with. You just pick up the pin. But for a child who is autistic, some of them, their hearing is so intense that if you drop a pin, it's like an explosion. It's like a real explosion. And they hear things very intense and very, very loud. And they have to wall themselves in. They have to be silent. They have to just withdraw within themselves because they can't stand the overstimulation of so much noise, because to them it's horrible noise. And if we were hearing that way, it would be just as horrible to us. In this one particular child, a surgeon, they did surgery and they took out something in the ear so that the hearing would be less intense. And when the hearing was less intense and not as loud, the child pulled out of it and started to recover. Now, if you're holding a baby and they don't respond to you, you have to check physical senses. There's a possibility that the child might be deaf or the child might be blind, and naturally they're not going to respond in the same kind of way, although there usually is a response of some kind. But with autism, there may be no response at all. And it's like they're just in their own private world. They don't have any attachment. So that's an example of an attachment disorder. Now, I could go on from here, but I want to start something else. I want to finish what I have to say about PTSD, and I probably should wait till the next segment for that because I don't have much time to start it now. But just to let you know that when I go into a subject matter, I go into it fairly deeply. But the reason I do that is that I know a lot of you are watching me because you need to get help in understanding what you're going through. And so I don't want to just glance over something. I want to get into it deeply enough that it will be a help to you. I'm not doing it as deeply as I would with one of my college classes that I have taught, but enough so you can gain a lot of understanding, and that's what I want to do to help you out. We will be finishing PTSD next segment, and then I'm going to go into handling human emotions. And then after that, going to each emotion and discussing it and how to handle it, whether you're depressed or whether you're anxious or what are the practical things that you can do. And there's lots of other things that I have. So I'm going to close it here, and I hope you join me next time.